has recently got a new constitution of Nepal, and the constitution of Nepal has ensured the fundamental right on water and sanitation. And we have the three layers of government: federal, provincial, and the local level of government. And all those governments are making their act and regulation policies, and so still we have lots of gap to identify their roles and responsibility, how they can go together. So it is the area of remote where we supported the water and sanitation project, sustainable wash project, funded from WaterAid. And KEDAC Nepal is a Karnali Integrated Rural Development and Research Center, has been implementing this project since more than 3 years over the years. So the very tricky situation of the water and sanitation of those areas, because the local government has has very gap in knowledge, and there is very poor accountability mechanism, as it is very newly elected government at the local level. They do not have the sufficient capacity to bear, to finance, to skill, technical knowledge, somewhat. So in this area, there are lots of issues, lack of knowledge with the marginal people, and so much gap in capacity of the government, and in terms of financial and the technical part. And it's a limited engagement of the community, marginal people for their rights. Even they do not know that their right has been ensured in the constitution, that the right to have water and sanitation and fundamental right. And that the community CBOs are also very poor in capacity, and there is very limited access of water and sanitation to all, especially to the marginal people. This was the big challenge to us to advocate with the local government to allocate sufficient resources to fulfill the rights of the people and capacity building of the people. So for that we basically use maximize social accountability tools through the HRB, right-based approach in the community and as well as the local government level, especially focused to the local government. And that is the different tools like public audit and the community scorecard, and the most useful tools we use that the dialogue. The Kachari is the platform to discuss the issues of water and sanitation at grassroots level, focusing with the duty bearers and right holders. And then that is the best tools we have used, and it is very replicable not only in the water and sanitation sector, but also out of that sector, education, health, and then other food security and that all. The culture is very, very fabulous word in the area and in Nepal also. So we have, the KEDAC has been utilized this tool as a very transformative tools in the community with the government at different local, provincial, and the central level. We already did it, and it has been proved that it is very influential to the duty bearers and right holders. So that is called with Jal Kachari. In support of WaterAid, we did the Jal Kachari is a dialogue platform, loose platform. Especially we call it this very dialogue, effective dialogue platform to raise the issues, and in that issues we discuss with the policymakers and then duty bearers and right holders and all those people concerning with this, and then raise the issues from the right holders towards the duty bearers, and duty bearers listen it, and then jointly do the action plan, how we can address to those issues and by what time and how. So an agreed and the action plan prepared, and that action plan that initiated and frequently follow up later on.
So the kind of work that we're trying to do is not just about me here. It's about many people who are working in many different districts. People right from the district managers to the field staff who are working. This is the outcome of them, and I'm trying to. I hope that I'm able to articulate the work that we're trying to do district. We at Indian Foundation, we are trying to address a problem of drinking water quality and its impact on health of people. That is what is that we're trying to address. Very specifically, we are trying to address the problem of high fluoride and arsenic contamination in drinking water sources and its effect on human health. That is what we're trying to address. As you all know that groundwater right now is one of the major sources for drinking water, and when you do and the chances of finding any chemical contamination is much higher in groundwater sources, and so that's the reason these two contaminants, arsenic and fluoride, are one of the top two contaminants which are now taking space in the chemical contamination in this particular country. So if you look at the statistics, more than 20 states in India are having some kind of arsenic or fluoride contamination, and also the effects of fluorosis to people getting deformed, to even benign cancers, tumors. So there is a lot of effects that already we are actually seeing. So this is the issue that we're trying to address. And the way we are trying to address this is by changing things at a systemic level. When I say systemic level, we are trying to we are working, or the main approach that we are trying to work is building what we call a people-centric district water quality platform. When I said this district water quality platforms, they operate at two levels. So there is the coordination that is happening at the district level between different departments, and then there is also a work that is happening simultaneously on ground, where Interim is trying to try out solutions for safe water, improving safe water access to good nutrition, rehabilitation of people who are already affected with the disease. So these two particular processes, the one that we're trying to work at coordination between different departments like rural water supply, health department, education department, nutrition department. All these coordination, we're trying to have a district, we're calling this a district platform, so that it's a platform where different stakeholders which are associated on this particular issue meet regularly, at least once in 3 months, and then they come and discuss and make action plans to mitigate the particular issue. And also at the ground level, we are trying to support and trying to improve the access by innovative methods which can be scaled up to, and so this particular platform presents a forum where such best practices are shared among the different stakeholders, and those are taken to beyond districts, beyond blocks which Interim is working. So that is the approach that we are trying to work on, that is district water quality platforms. That is the main reason this approach has been working is because this district platform actually is institutionalized now. It's a formal structure that has been recognized by the district administration, where the district collector or the CEO of Zilla Parishad, he heads the particular committee. So there is a direct chance for accountability that's happening. Whatever decisions are taken are guided by the district itself, and the place for bringing the ground reporting is what the civil society actors like Interim and there are also local colleges who are part of it. So they are providing the kind of ground support that is required for capturing the reality of the ground. So these two things are working in parallel, and this is what the approach we are trying to work on.
I'm going to share about one of the initiatives which was taken by there is an informal collaboration of citizens, academicians and NGOs. So that is known as Citizens Voice Forum. They took an initiative 4 years back when the Swachh Bharat mission was started. So I'm going to share about that initiative, what they took. As the session progresses, I will discuss in detail, but it will be very brief. Actually, this sanitation program is not new to India. There have been many programs before Swachh So this citizens watch forum also came forward because what was the gaps in the programs they identified earlier also, means there was no accountability tools. In the guidelines there were many things mentioned, but in reality those things were not happening. So accountability and service delivery was there, means they were targeting to achieve open defecation free status, means how many toilets needs to be built, that target was there. But accountability for good toilet and to giving toilets to persons with disability, for transgender persons, for areas where this kind of toilet, that universal design which is mainly followed across India, that may not work, that things were not there, so that they can get feedback from the citizens, and then they can take action that this type of error doesn't happen in the implementation of such permission. Second thing was there was no tool for participation from the citizens. In guideline it is mentioned that it will be a community-led sanitation program, but in actual sense it was happening that collector was leading those programs. That was coercive measures were also being taken. So to give a constructive feedback, the Citizens Watch Forum started this citizens report card kind of initiative, where they took many indicators. In Swachh Bharat Mission there is a MIS system, but that captures only the progress, coverage of toilet. But that doesn't capture many qualitative and different aspects which are very much required to ensure the quality of that program. So they took those indicators which are not there, and they identified gaps, and they started annual citizens report card to give constructive feedback to the implementers, so that they get to know what things are working in the field and what things are not working in the field, and they can improve. All these citizens report card, WaterAid supported that Citizens Watch Forum in terms of providing technical support, in terms of providing tools.
So the fact is that when it is both the problem of arsenic and fluoride, it's required some scientific way of analysis, which is completely a lab-based one. When we talked about the arsenic manifestation in the skins, say for the pigmentation, or you talk about the fluorosis, where you talk about the dental or skeletal fluorosis, it's a manifestation in the body. So if one person who is completely get affected, he have got his own perception why he's been in that stage. Some of the cases they talk about a polio, some of the stage they talk about some superstition. So these are the things in the perception of a particular person, right? So we have got first a lab-based intervention when we test the water quality linked with the health indicators, and then we share with the people that this is the problem is due to your accessing unsafe water. First, that is the first point. Now when we are sharing that thing, we are changing the perception of the person. Now when we are changing the perception of the person, the efficient tool is to how you simplify that entire information in their language, their traditional practices. First is that challenge. That we do with a participatory technique, that when we want to share the information, we start with a very people-centric approach. We start with their health problems, with the water quality, right? First. Second is that when we talk about the solutions, we never talks about a solution which are very alien to them, first of all. We talk about, like, for some of the cases, we have a discussion on the nutrition level. We hear about some of the nutrition method that is being applied in the Jabalpur area, which is promoted by Indian Council of Medical Research, under Dr. Tapas Chakwan. Then we have a discussion, we found that there is certain indigenous material that is available on their food. So we try to collect all the information of the behavior change, what is available in their context, not taking something alien. So that's the first thing that we do, that what are the things available at the local level for the solution. Like, well, how can you make to restore the well, that surface water, what they can contribute, what are the surface water sources available, what are the food nutrients available, and what is there be interpreted in their local languages. Then the behavior could get changed. So these are the few things we have applied in the fluoride affected areas field, for providing us safe water first. Second, we talked about this the local planning process. I was just getting into discussion. So this local planning process is that if you have a set of stakeholders, the elected one, the panchayat one, if they have the enough capacity for the planning, then you can infuse your plan. But if it is a bureaucratic way of calling, if somebody in the district magistrate is taking a call and is completely implementing the project, you don't have the capacity to hold that elected representative. So there is no question of accountability comes in the case of the water quality. And water quality is a subject where you have the services, but the accountability, you cannot search the accountability of the person. So there is a services, there is absence of accountability. So we need to talk that entire thing with the department, then with the local plan. So the two things that I have covered over here, one is the behavior change one, which we use the indigenous technique, indigenous thing. Second, the accountability one, when we talk about the local plans and translating the local plans in the panchayat, take to the district magistrate, but we also use the what are the things available inside the panchayat.
Okay, thanks. And you work with Muslim community specifically?
We work with the Mushar community. One of the interesting thing I just want to share, that we started the behavior change method for the Mushar community 1 year before. 1 year after, we found a very interesting case study from the China Xi'an province. The peoples who are accessing a high contaminated water, say from fluoride or arsenic, their IQ is getting affected very deeply. So when we are passing the information to the peoples, so we will finding that the information that we are passing, that people is not listening, but their intelligent quotient is already decreasing day by day after taking this contaminated water. And that is a very interesting thing, because we are trying our best, but the health problems that we are seeing at our own level, it's not working well.
So we started with this idea of district platform because we know that fluorosis is a very complex problem. So there is a need of different departments to come together, departments like rural water supply, health department, education department, nutrition department. So all this, our experiments, our approach to doing an integrated way started in Nalgonda. Nalgonda, which is one of the highest fluoride affected districts in India, where there was a speaker of the then Andhra Pradesh government decided to do a holistic intervention for fluorosis, and that was the first district water quality for fluoride. It was the first in India. So what happened there is there were 17 line departments that were actually brought together. So, but what we thought, and then from learning from that particular experience, what we thought that it is good to to formalize this particular process. So, when we start doing any intervention on the water quality issues, we try to formalize this particular number of members who would be part of this particular platform. And we reduced it because we know that 17 is a long list of participants. So we reduced it to 4 or 5 departments who are there, and then we try to formalize this kind of structure with help of the district collector. So what happened is, in many cases, for example, we take case of Rajasthan, we had UNICEF coming in and helping us in formalizing this particular process. And in case of Odisha, we had the member of parliament who came ahead and formalized this kind of particular structure. So at various, it has not been the same way of formalizing such situation in every district. Depending upon the severity of the issue in that particular district and who is interested, there have been individuals to organizations who have helped in formalizing this particular structure, the idea, and then because we recognize the roles that rural water supply has to supply safe water, the health department who is going to do rehabilitation of the already affected patients, and then there is education department and the ICDS department where schools and young children and young pregnant women are present. So these are departments. The roles are we are able to these roles are accepted by the departments, and it's within their mandate, and that's how we are able to get their acceptance. Because once you get the acceptance, the roles, the formalizing of that particular structure is easier, and that's how we have been able to get many departments together, because their roles are clearly within their departmental mandates, and then and we have support of such individuals and organizations like UNICEF who have a certain level of advocacy. They are able to advocate with the government at that particular level. So that has helped. That has helped in getting all the partners together. And then severity of the issue is always something that decides the level of people coming, meeting. For example, Nalgonda, if there is a meeting, then fluorosis is actually a priority issue, not even for the agriculture department. Hence, they also are joining willingness to come and then join as to be part of that particular committee, and then they are trying to see ways in which how they can advocate farmers to use efficient irrigation practices, so that there is they use less water in irrigation, which will directly help in dilution of fluoride and arsenic. So that's how we are able to get all the partners on board.